It's my pleasure to introduce Dr. Kesar Prasad sir. Ayurmitra Nadi Bhishak Jyotisha Vaidya, Professor Dr. Kesar Prasad sir hails from Hyderabad and did his MD in Kaya Chikitsa from Dr. BRKR Government Ayurvedic College, Hyderabad, and PhD in Astrodiagnosis. He is presently working as professor and head in Department of Panchakarma, LN Ayurveda College and Hospital, Bhopal. He has a rich experience in various fields of Ayurveda, including administration, research, and teaching for over 25 years, including 12 years of guidance for postgraduates. Dr. Kesar Prasad sir is a multifaceted personality who can speak in various languages like Sanskrit, Telugu, Kannada, English, German. He has served in colleges across India, including Sri Jagadguru Gavisiddheshwara Ayurvedic Medical College and Hospital, Koppal, Karnataka, Amrita School of Ayurveda, Amritapuri, Kerala, Mahatma Gandhi Ayurveda College, Wardha, Maharashtra. He is the founder of Techno Ayurveda, propagator and publisher of Techno Ayurveda module, Techno Ayurveda Research Utility, Astrologic Medicine, Ayurjyotish, and Allied Sciences. He is an esteemed advisor for institutions in India and abroad. Some of them include Association of Ayurvedic Professionals of North America, including USA, and Maharishi Kashyapa Ayurvedic Research Foundation, Kerala. He is the chief faculty of Canadian College of Ayurveda, Canada, and member of Board of Governors, Digital University of Skill Resurgence, a virtual meta university. He is serving as the executive editor of International Journal of Research in Ayurveda and Medical Sciences and is part of the editorial team of International Journal of Ayurvedic Medicine. He is the life member of National Integrated Medical Association, an ex-boss member of the Calicut University, and the ex-chief editor of Joint Med. He has presented in numerous national and international conferences and delivered lecture as resource person. He has published more than 7 books like in Introduction to Evidence-Based Panchakarma, Techno Ayurveda SOP Practical Panchakarma, Art of Panchakarma, chaptered in Pulse Diagnosis, and 42 research papers. He also has 21 copyrights over Panchakarma procedure formats. We are happy to have such a dynamic and inspiring personality like you, sir. And we are fortunate to hear from you today. Once again, I welcome you on behalf of our institution. Thank you, sir, and over to you.
Thank you very much. Hope I am audible to you all. I am very much thankful to Dr. Veena Madam and Mamta Madam and all the people, those who are active from the JSS Ayurvedic Medical College of Mysore. Today, as a series of the lectures which we are getting from the JSS, out of, I would like to focus some of the diseases which I come across and I treated very successfully with. Now today, I will start my lecture with the PPT. Now here,
visible, sir.
Hope you are able to see it.
Yes, sir, it is visible, sir.
Yes, thank you. And this YUKTI recollects the Yukti Vipassana Chikitsa in Ayurveda. The Vatavyadhis, Asiti Vatavyadhis out of, I just focus 2 diseases, Pakshakata and Katishula. One disclaimer before to that of initiating the lecture. Loko Bhinna Ruchihi. We understand the Ayurveda in a different way and different levels. I am presenting here as I understand the Ayurveda. As we observe, the life sciences are going to be so flexible like God. The Almighty is flexible. He comes in whatever the shape we think. He is going to appear, he is going to be witnessed in whatever the way we believe. Medicine also is so flexible. It is going to be, however you are going to attribute the principles, like the same it is going to be. As to start with this today's lecture of the different cases which we come across, a little prologue about the Vata and ourselves, we have to make it out. As I was speaking, the Ayurveda is speaking the many principles of the healthy living and treatments for the pathological conditions, undoubtedly. Are these principles are applicable for today? Because we say thousands of the years ago, the Ayurveda was narrated. The narrated Ayurveda almost 2000 years as per the some people. But I feel this Charaka Susruta Vagbhatas, of course, we can very clearly carbon-date the Susruta and Vagbhata, but whereas Charaka Samhita, we got the lots of the conflicts. Yes, I understand this is after the Ramayana period. Ramayana period is in the 24th Mahayuga, and we are living at present in the 28th Mahayuga. That means this is very old and very traditional. Of course, it got some of the additions, subtractions, and so on. But question here is the descriptions of the anatomy and physiology which has been come across in Charaka Samhita were not exactly being witnessed today. Are we practice the principles which are taught in our Samhitas as it is intact? Even this is a very big question even. Disease is said to be with diseasiness and the pathology is with the dosha disturbances. When we are observing this dosha vitiation, then we have to attempt for an evaluation of the disease and treatment, which we have to regulate. First and foremost is the lifestyle according to Ayurveda principles and therapeutics. Almost all the diseases whichever we are witnessing today, as pathologies which we are witnessing today, either they are with the deviated lifestyles or with deviated food habits. Nowhere it is being exclusively from the inner side it has been derived. That means Nija Agantuja doshas which we are speaking and Nija Agantuja vyadis which we are speaking, they are coming very appropriatively as per the principle is. But when we are tackling it, a person whoever is coming with that of the hypertension, we are asking them to calm down and make the regularization of their stress. In fact, no patient is able to follow it even. Then how to treat? Because most of the time, the Ayurveda is enculping the nature for the circumstances, thereby the disease-free body is being brought out. So the lifestyle is to be targeted first and foremost, always, all the time. Here I would like to give a small glimpses. When I am working in one of the remote area of the Karnataka, Koppa, I got a patient referred by my boss, the owner of the institution, Ramesh Ravji. The patient is with osteoporosis, diagnosed. When I inquired his lifestyles, he said he is getting up around 11:30, 12 o'clock in the noon. My treatment started with, I said, I have given Asti Srinkala Kashaya and Aditya Paka Gugulu. Asti Srinkala Kashaya, I said, this Kashaya, you prepare it in the night and you have to expose for the early morning sun rays, then you have to gulp it. The patient was forced to wake up before sunrise. Then ultimately, you doesn't believe within a matter of 2 weeks, 10 to 15 days, the person was once again examined with the machine and there is no osteoporosis and the bone is normal. How come this bone mass density has become normal? Is it is with only Astisrinkala Kashayam, Aditya Paka Gugulu? No, not at all. It is because of the regulating the circadian rhythms. Whenever we are attempting any patient, the first and foremost, we have to regulate the circadian rhythms. The circadian rhythm regulation makes the serotonin-melatonin axis regulated. While making this regulation, automatically the person is going to become prone for the or ready for taking the effect of the Ayurveda medicines and Ayurveda principles. Now, the Vata. We speak about the three doshas, Vata, Pitta, Kapha, initially the Charaka, 24th Mahayuga, and in the 28th Mahayuga, Sushruta included the Rakta also, because of the expansion of the life sciences. The Vata diseases, there are 80 being nomenclated. If we see the subclasses and other things, they may be growing even more than 80 also for the present, but basically 80. The Vata is with the two Mahabhutas, Vayu Mahabhuta and Akash Mahabhuta, representing the Gati and Gandhana. Va Gati Gandhanayo, when we said Gati is the momentum and Gandhana is a perception. How to understand this Vata, whether we can measure the Vata? Because when the Vata we are speaking, it is not having any shape, size as it is Vibhu Bhagavan like. And how come we are going to measure it? Many times it is being stated that Vata cannot be measured. It could be understood only through that of its actions. But the Vata can be understood very comfortably with the evoked potentials. These evoked potentials are different in nature. The motor activity measured from the arm or leg muscles, visual from the duk, that is a monoocular visual stimulation with a checkerboard pattern which is used here to elicit the visual evoked potentials. They are recorded from the mid-occipital region of the skull. That means we are able to understand the activity of the Vata. If it is of the Srotra, auditory, the monaural stimulations with the respective clicks when we are going to see, and even the audiometry is going to be useful. And brainstem auditory evolved or evoked potentials are going to get measured. These are not being brought into our practices. That is the reason why we are saying blind belief of the treatments still we are following. We have to bring out this evoked potential examination as a pattern of Vata examination, Vata disease examination. At that time, we are going to make very successful practice of the Ayurveda. Now, if it is a somatosensory, Gandhana, electrical stimulations of a peripheral nerve is used to elicit the somatosensory evoked potentials, which are recorded over the scalp and spine also simultaneously. Now, when we see what is this MEP or the motor evoked potentials, Vata Gati, these action potentials are being generated in the cortex, travel down to the pyramidal pathway to the muscles. Afferent and efferent pathways, which we are going to specifically understand even for the Vata also. Surface electrodes placed on the arm or leg muscles are used to record this and summed motor potentials. These potentials are larger, easier to record even. When the subject lightly contracts the corresponding muscle of the beforehand, we can make out these MEPs. An abnormality MEP impulses are going to show a lesion of the conductivity. Here, I am bringing out two things. One is a degenerative processes which are going to hamper without structural deformities or of the one variety of the Vata disorders. The second variety of the Vata disorders with a break in the conduction. The conduction could be at various levels. A somatosensory evoked potential SSEPs of the Vata Gandhana, when we are going to see, here the pathway is like repetitive electrical stimulus is being applied to the skin. These impulses are being generated and terminal sensory branch to the peripheral nerve and conducted centrally via peripheral nerve to the nerve root, posterior columns and spinothalamic tract, ultimately medial, lemniscus and the thalamocortical connections. When any lesion in any point in between, it is a pathway when it is going to be get interrupted, will be recorded, and we recorded first over the erb point on the median nerve for the standardization or the lumbar spine, tibial nerve. And then through a scalp electrode in the parietal region of the opposite side. So here, what exactly Ayurveda speak while speaking the Pakshaghata, we could Paksham Anyataram Hanti is very comfortably observed here even in the somatosensory evoked potentials. Of course, still these are basic examination methods of the Vata. Of course, we are having today even two-dimensional, three-dimensional MRIs also. When we have this minimal examination done, we can substantiate our Ayurveda, either the Charaka Samhita or Susu Samhita said, with reference to that of the Pakshaghata, very specifically here I am targeting. A regional involvement or the global involvement is going to be observed in any Pakshaghata patient. When this Pakshaghata patient, we have the monoplegia, quadriplegia, like many of the things. And here we have two varieties of the common paralytic strokes, which is of the spastic in nature, non-spastic in nature. Here, the extrapyramidal lesions and the pyramidal lesions could be differentiated very comfortably. In this Pakshaghata, the Vaksthana or the other way, the Adhita is not going to be there or the speech is not being interfered in the extrapyramidal or the pyramidal even. This is otherwise we can understand a Susrutoka Pakshaghata like. When we see the Vata Vyadhi as a motor syndromes of the cerebral palsy made out, commonly we find the 25% of the spastic hemiplegia, 35% of the spastic diplegia, either of the Ubhaya, Urdhva or Adho. Spastic quadriplegia is 20%, and the last one which we are going to see is extrapyramidal lesions are of the 15%. See, when we are speaking about the Adhita, the many of the Adhitas when we are going to get, they are not at all connected to that of the nerve system, and they are very easily treated with some sort of the cortisones or even simply Lashuna Kalka. When I am a student at BAMS, I'm speaking of the 1980s, we had a lecture by our lecturer, and he said the Lashuna Kalka is going to treat very successfully the Adhita. We have to enmask this Lashuna Kalka 10 grams, 1 tola, in musk, in the butter, and this butter is being consumed daily. Within 7 days, the result is going to be seen. We said, we challenged as a student only. How come it is going to be possible? If at all it is going to be, then why did these many people of the Adhita are here? Then even he supported us, and we started taking the patients directly 7 days. 90% of the patients has recovered in 7 days. 10% patients could not be recovered, maybe because of the other reasons. At that time, we may not be able to get evaluated. Out of these syndromes of the paralysis, when we see very specifically the Vata Vyadhi which we forget, I just want to remind here, is the Anubandhata and the Dhatukshaya or the Margavarana. The first level of the Pittanubandha, Kafanubandha. When a Pakshaghata is going to come, how to identify a Pittanubandha, Kafanubandha, Pakshaghata is a question. Daham, Chosham, Vosham, Plosham, these are the things which are attributed to that of the Pitta, but whereas the Kapha, Stabdhata and etc. In both cases of the either the Pittanubandha or Kafanubandha, Akarmanyata of the limbs is mandatory. It is there already. That is the reason why we said it as Pakshaghata. Dhatukshayajanya Pakshaghata and Margavarana Pakshaghata. When we see beginner's luck, I just say, from this beginning, I was not accepting the serendipity. When we are speaking about the serendipity, this serendipity is said as the Adrucha Siddhi. Vinatarkena Yachiddhi Adrucha Siddhirevasa. This is the sentence which I learned at the very beginning. If any of the treatment is not able to get substantiated, it is just only an accidental success. Many of our physicians make the accidental success validation as they focus more and more is there. We need to repeat the same thing. When we are asking for the evidences and the repeatability of the same prescription, they say there will be lots of the things like Prakriti, Vikruti, etc. is going to come. They are the examination methodologies to understand a pathology. Now, there is no, I was searching in entire the books. Was there any medicine being prescribed by the Charaka-Susrita Vagbadas based on the Prakriti? No medicine is being prescribed based on the Prakriti. It is only Lakshana. It is only of the Dosha, Dushya, Sammurchana, Vighatana. Based on these 2 points only, they have prescribed the medicines. When the Dhatu Kshayajanya Pakshaghata is going to be there, the Brahmana therapy is required. If it is of the Margavarana, then we need the Sodhana. One, the Pitta and Kapha Anubandha Chikitsa, Anubandhatva, how to understand? A simplified methodology is going to be all the Pitta Anubandha Pakshaghatas which are going to exhibit these symptoms and signs are going to be derived because of bleeding, cerebral bleeding, and hypertensive patients are going to be there with. A Kaphanubandha Pakshaghata is going to be associated with the diabetic patients and the atherosclerosis. That means here we are differentiating whether it is a Pitta Anubandha or the Kaphanubandhatva. Based on the Anubandha, prescription of the Ayurveda is going to be get changed. Now, first case of the Pakshaghata which I am trying to present here. A female aged 32 years with overweight and hypertension got sudden loss of lower limbs strength and impaired and sluggish speech is there. Patient belongs to the below poverty line, BPL, and economically weak. So within 12 hours of the stroke, patient is attended with the Ayurveda medicine. They came to me. As patient is with the hypertension, observed with the Pitta Anubandha Lakshanas. Here I said, hypertension, whenever it is there, 99.9% is going to be of the Pitta Anubandha only. The simple prescriptions what I have given is Rasna Saptaka 40 ml, Gandharva Hastadi Kvata 40 ml at 6 a.m. Now, first of all, I want to make the circadian rhythms regulation. We say the Anulomana is going to be with the Gandharva Hastadi Kvata, and whereas the Rasna Saptaka Kvata is going to make the Vata conductivity regulation. Here in Karnataka at that time, I was getting the Vata Chintamani without gold. This is Bruhadvata Chintamani. Bruhat is with the gold. Without gold, there is a Vata Chintamani. I was giving the tapering dose of the 2 tablets, 2 morning, afternoon, evening. That means for every 8 hours, the patient is getting, and half-life period of the Vata Chintamani is restored, maintained. I have added with the Ekang Virarasa. The Ekang Virarasa is observed as it is like anticoagulant. whenever we are trying to make any blood not to getting coagulated or being blood thinning is expected in any patient, at the time the Ekangvir Rasa is going to be very comfortable. And I externally have given the Vishagarbha Tailam and eucalyptus oil application only. It is not Abhyanga. Vishagarbha Tailam and eucalyptus oil is being mixed together and applied over the body, because the eucalyptus oil is being volatile in nature. It makes very faster and sooner the circulation, and it acts as a counter irritant most of the time. What is the result? The patient recovered in 18 hours and started talking. And 48 hours she took to walk with support. After that, we continued with the rest of the medications and prescriptions, and thereby. This case, mostly it is of the pyramidal in nature. Any case, Pakshaghata, whichever is going to respond very fast enough and not at all giving any sort of the further complications, is of the pyramidal in nature. Now, the case 2 of the Pakshaghata. Here, a male, lean male, he is a very lean, aged 45 years with hypertension, got stroke and admitted in ICU for 10 days. The patient attenders approached me for the Ayurveda treatment. I said, I can make the treatment only in my hospital. I cannot treat anywhere. Patient is stable for the hypertension, but right side, upper and lower limbs are paralyzed in toto. Patient's speech is sluggish and incapable of either walk or hold anything in the hand. Here, once again, it is of the Pittanubandha Pakshaghata. Here, the prescription is slightly changed, you see. Dashamula Kwatha 40 ml, Gandharva Hastadi Kwatha 40 ml at 6 a.m. This I consider as a Patikashaya. The Patikashayas usually we administer in Panchakarma before making the patient to lie down on the droni. But 6 o'clock medication is going to regulate the circadian rhythms. Usually I give in between 4:30 to 6 o'clock in between. The second here, it is the Vata Chintamani with gold. This is Brihad Vata Chintamani, because that particular area was not available with the Vata Chintamani. 1 TDS is the tapering dose being given for the first 3 days. That means 8th hourly 1 tablet. Later it has been made as a 1 BD. Many a times what I have observed here also, when we are prescribing the gold medicines, people are got fear of this cost effectiveness. Medicine is a medicine, whatever the quantity required has to be given. I have given the Vata Chintamani for some of the patients, even for every 6 hours also, for 1 week, 10 days also. They are very delayed approach to the Ayurveda medicine. They came after 3 months, 4 months. At that time, to make the standardization, regularization, half-life period restoration, I have to give a tapering dose even. Here the Ekangvir Rasa once again being given 2 TDS as a standard dose. Externally, Balashwagandhadi Taila, Murivenna oil for the Abhyanga and Swetakarma is being given. Here this patient was as already with the severe symptoms which he has shown. The Yogavasti with Dashamula and Mahanarayana Tailam, Dashamula Kashaya and the Mahanarayana Taila has been given. I consider there is a partial Dhatu Kshaya also for this particular patient. Vacha and honey application over the tongue has been made. And the result is very astonishing. The patient started talking by 6th day and walking with support on 12th day. Fine finger movements developed after 10 days. Patient is 95% normal by 30th day. So I just want to tell one thing. A paralytic patient, whether it is of the pyramidal in nature or extrapyramidal in nature, we can treat paralytic patients very comfortably within the 3 months or 90 days. Why this 90 days? You might be very comfortably understanding the tissue generations. The 120 days, usually the blood cells are going to be there with. How long when you see the ultimate Saptama Dhatu, Sukra, is going to last for a few hours. This Majja, Mastulanga Majja, is sixth one. This sixth Dhatu, which is going to be from 120 days to the lesser time, it is going to be taking for the recovery time. This up to 6 months of the period, whenever we get this paralytic patient, the percentage wise we can make it out. As early as they approach to us, we can just do with simple prescription many things. Not even very big Panchakarmas are also required. Case 3 Pakshaghata, here I would like to focus. Here this is a male, aged around 50 years, overweight and diabetic, gradually developed inactive upper and lower limbs in a duration of the 7 days. Numbness is there and later slowly started developing this paralytic stroke symptoms. Patient approached on 25th day of his stroke and non-spastic in nature. This was comfortable for me. Spastic patients, I get little trouble to treat sometimes. Here the prescription has been changed because there is Avarana is also there. Partial Dhatuksha is also there because he is 50 years of the age. And also, especially here, the Kapha is the most predominating. The Sahacharadi Vata 40 ml, whenever it is a mostly Kaphanubandha Vata, is going to be the Sahachara is going to be one of the drug of the choice, which I have observed. And Gandharva Hastadi Vata 40 ml, these two together at 6 o'clock to regulate the circadian rhythms. Because the person is so heavy, even he could not lift his own body. Now the question here, I did not use this Vata Chintamani because Vata Chintamani is effective in Pittanabandha Pakshaghata, but it is never going to have any effect over the Kaphanubandha Pakshaghata. The Kaphanubandha Pakshaghata, best drug is the Yogendra Rasa. 1 TDS is being given for first 5 days and later 1 BD. This is also with gold. And when I have used this Yogendra Rasa, it makes some sort of the Rasayana and Lekana Karma simultaneously. Ekangavir Rasa, as usual, being given here. Here, one more thing is being given is the Vishatindukavati. This person is a diabetic. Whenever there is a diabetes, Vishatinduka is one of the best medicine to give a regulation. A diabetic neuropathy, diabetic retinopathy, or otherwise erectile dysfunction based because of the diabetic. When it is being added with that of the Vishatindukavati enhances the cyclical action of the nerve conduction. When the nerve conduction is going to be impaired, then only Kaphanubandha Pakshaghata predominates most of the time. The externally also I have given the Vishagarbha Tailam along with the Saindhavadi Tailam, Murivenna for the Abhyanga and Sweda Karma of the standard. The result here is patient started losing weight from his 7th day. See, in the prescription, there is no Medoharavati or Medopachakavati or any other thing except the Saindhavadi Taila, which is externally being given. He started losing his weight from the 7th day and able to stand on his own legs on the day 10. He recovered only 75% by the day 30. He is not totally recovered within the 30 days of the stipulation. There will be some of the superseded pathological conditions also make out because we have to treat them also simultaneously. At the time, we are going to get comfortably how these patients are going to be made out. But The patient is very happy as he is 75% normal within 30 days of the approach day. Now, the second area of the lumbago sciatica, or otherwise the Kati Shula in general, which we are going to say. Shula is a Shula, pain. When we are going to see, the pain categorizations are going to be made. We have to measure it from the 1 to 10 scale. Pain scales are to be used in a better way is said to be. The secondly, when we see this faint pain, commonly the upper back is going to give a faint pains, whereas the mild pain is going to be there with that of the buttocks, or the when it is going to become a sciatica, mild to moderate. And intense pain is going to be reported by the patients usually when it is of the lumbar in originations. The lumbar originative pain to be treated very comfortably. When we can treat this, when we cannot. Say IVDP, intervertebral disc prolapse, is the very commonest thing which is being observed as on today, and the back pain. When we are going to see this ligamentum flavum, which is going to be at the side of the spinal cord, if it is going to become more thick and thick, it becomes the more rigid treatment for this lumbago sciatica syndrome and Kati Shula. If it is not going to be so thick enough, what actually happens here is the ligamentum flavum is a supportive mechanism to that of the spine, and it is going to try to support the spine. But what actually happens when the disc desiccation or the dhatu kshaya is going to be seen, at that time it is going to be ligamentum flavum is getting thickened. This thickened ligamentum flavum is trying to support the vertebral column. But what happens when it is being stout and it is being moderately thickening, it is going to contract and it is going to pull the vertebra rather than supporting the vertebra. That's why the more damage is going to occur at that time. Now this Kati Shula case 1. A female aged 48 years under stress and activity more, got severe pain in lumbar region and observed no bony lesions here. This is simple Kati Shula which we can say as such. Here, very simple, only 1 day treatment was done. When the patient approached, Pati Kashaya, Gandharva Hastadi Kvata 40 ml, Rasna Sapta Kvata 40 ml is being given, and patient is on laying down on droning. Kati Vasti with Kotam Chukadi Taila, 30 minutes has been done, and later continued Abjanga with the same Kotam Chukadi Taila. Here the Kotam Chukam is Kushta and Shunti. Shunti is a pain reliever very specifically. And Kotam Chukadi Taila for 30 minutes Abhyanga has been given. After that, Swedana is being given in the box. The 20 minutes of the Swedana. By the time it is around 1.5 hours of taking this Gandharva Hastadi Kvata and Rasna Sapta Kvata, the patient was urged to go for the defecation. She passed the very dark black stools and immediately the pain is vanished. Later, never she got any pain. This was the first case when long back I have observed it. After that, I started making the same continuation of things. Whenever there is a back pain, I was observing Malavashtambha, or the constipation is one of the commonest symptoms in Apanavata Vikriti. Whenever there is any lumbar area pain is going to be there, lumbago sciatica syndrome is there, at the time, the compulsory, the person is going to have the constipation. Later, I was observed, even with the erectile dysfunction also constipation is being. That means, whatever the Apanavata Vikritis are being mentioned in Ayurveda, all these Apanavata Vikritis are linked with that of the constipation. That means If at all you are going to give the Gandharva Hastadi Kwatha or Gandharva Haritaki Churna and make the patient to go normal defecation along with Ye Vata Hara Kashaya, choose accordingly either the Rasna or the Balashwagandhar, etc. Thereby, the person is going to get a dark black color stools. When the patient is going to say, that means you can think a 50% of the problem of the Katishula has been relieved. Then this person, I was inquiring after 1 month, after 2 months, whether she got once again anytime. Never she got any lumbar pain at all. Before to that, she was unable to sit and stand even. The second case of the Katishula here I want to present is a male aged 31 years, a well-built, came with IVDP and disc desiccation, disc bulge and stenosis. This is a very difficult case, to be frank. A total restricted lateral movements and forward bending is there with this patient. What I have given is Patikashaya. Here I have used Trifala Kwatha, Rasnadi Kwatha and Gandharva Hastadi Churna, 10 grams. This is being given every day morning at 6 o'clock as per the principle of. And Rasa Rajeshwara Rasa 1 TDS and Gokshadi Gugulu 2 TDS are being given internally. And Kativasti and Abhyanga with Murivanna and Kottam Chukkadi Taila and Arkapatra Tapasveda has been selected here. I was observing all these Vishadravyas. One is the Arka, second is the Gunja, third is the Kanaka, Datura. The Arkapatra Tapasveda has been wonderfully working for him, and Murivanna has restored the action and Rasayana effect is being there. And Matra Vasti here has been given with the Asti Shrinkala and Bala Taila. Asti Shrinkala Taila and Bala Taila has been prepared. Asti Shrinkala Taila has been prepared, and along with the Bala Taila, the Matra Vasti is being given, 15 ml each. And Kanaka Lepam has been given externally. After that, the patient responded to the treatment and symptomatically normal. But after the 3 months also, the IVDP, the narrowing of the stenotic area was not being regulated. But his lifestyle was made comfortable. This patient, after 5 years, when he got second time the pain, he said, I want to undergo for the surgery. Ultimately, the patient underwent surgery after 5 years. That means, one thing I have observed, out of this Katishula, whenever this IVDPs are, we can make the palliative, and if at all we can induce the Ayurveda or Ayurveda way of living or lifestyle rectification, if at all we make, that person would have not necessary with any surgery. Because he could not change his lifestyle, he wants to undergo the surgery. So just here today, I want to conclude with a couple of cases which I have narrated. Even though time-tested Charaka Susruta Vagbhatas states the principles of the management of many lifestyle disorders and diseases are derivative pathology are being spread in the nature. For that, we need to emphasize the principles to know Avarana and Anubandha very specifically in any of the Vata Vyadhi. Then only the dosha, dushya, vivechana could be properly made, and Avarana, Anubandha, when we are having these 4 paternizations, then automatically we can give a effective treatment. Common principles when we are working with, they do work effectively in test conditions. A car under test condition gives 25 kmpl, but in city it gives only 16. Here the same problem is going to be there with Ayurveda. If the lifestyle rectification is done, it is going to be giving highest efficacy. If the lifestyle rectification is not done, it gives lowest efficacy. 50% we can say. Otherwise, even reoccurrences are going to be get observed here. We need not blame Ayurveda as non-capable. When we do follow the principles, then the treatments are going to be successful. Unsuccessful cases in my 45 years are very less. Only one area, Trivanga Bhasma, I got the reaction. That too, a skin rash. Otherwise, no Ayurvedic medicines. Whenever I use the Kanchanara Gugulu as a pain reliever condition in any of the Vata Vyadhi, I go for the 5 grams of the Kanchanara Gugulu. Previously, we used to get the 300 grams. At present, we are getting only 100 grams Kanchanara Gugulu. If it is of the palm, 5 grams, I don't want to count by tablet. I want to go with the 5 grams, that is a 5 karsha. In divided doses also sometimes I give. Thereby, the quantification of the medicine which we are giving look like a veterinary dose, a higher dose. But unless a proper dose is not being given, a patient, how come a treatment or disease specification is going to happening? That I cannot make it out. For this, I started making the attempt of the 2-3 areas. Number one, I want to make a pulse diagnosis for the Panchakarma. This I derived a special way of the Tantu pulse diagnosis, and I started making the practical SOP Panchakarma, standard operative procedures of the Panchakarma. This to be linked with that of the medical astrology like Ayur Jyotisha. This is my passion. By giving the date of birth, even I could make a person to understand what sort of the disease at what ages he is going to get and what sort of the rectification measures are to be followed with. So here I stop, and I am very much thankful for the organizers of the YUKTI 2021-2022, and especially Dr. Veena Madam and all the faculty of the JSS. Thank you very much. If at all there are any questions, then we may continue with.
Thank you. Thank you very much, sir, for your wonderful presentation. You have presented so many cases with all the selection of oral medications and even the treatments. And we have some questions from the PG scholars. Is it okay, sir?
Yes, madam, please.
See, why in the case 1 Pakshagata, the Vishagarbha Taila is selected for Abhyanga and Balashwagandha Taila in second case?
Okay. Already I have narrated while speaking only about the first case. It is a Pittanubandha Pakshaghata. First case, it is a Pittanubandha Pakshaghata. Here I did not use any sort of, here the Vishagarbha Taila has been used along with eucalyptus oil.
Eucalyptus oil.
Yes. Why it is so? The eucalyptus oil is going to make the rate of absorption to be get increased. Whenever I want this Vishagarbha, the kapha or the obstructive phenomenon, because already the patient is a little obese, the skin thickness is much more. I want the peripheral neural initiation through the Vishagarbha, and the medium I have taken is the eucalyptus oil to have a penetrability and to reach faster to that of the target area. Eucalyptus oil is the only vehicle. And whereas the Vishagarbha is reaching faster to that of the peripheral neural ends.
Actually, it contains Datura and Naxomika, that is Kupila and
Datura I have used elsewhere, madam. Datura is antispastic to be used in comfortable. Kanakalepam is having the Datura. I have used in the lumbar pain area, Kanakalepam, This is a standard preparation.
Yeah, actually, what can be your comment on any Mastishkas in the treatment of Pakshagata? Any
Mastishka was not at all necessary. It became, madam, only in the after the 3 months when the patients are going to approach with the Pakshagata. At that time only, I used to apply with this Nasya Karma. Otherwise, the Nasya Karma was not at all necessary. Whenever we are applying the Nasya Karma in Pakshagata patients, that too after 3 months of the stroke time, that is 90 days. At the time, very specifically, I use this Masha and with Dugdha and occasionally with Lasana. How it is being given? The Masha, this Udat, is going to be soaked in water in the night. In the morning, this 5 grams of the Udat, which is being soaked, has been added with little milk and crushed, and so that the juice is being extracted. This is being given as a Nasya, Masha Nasya. This is one of the Brahmana Nasya which I observe, and many cases which are going to be seen with the Pakshagata after the 3 months, Brahmana Kriya is necessary. That's why this Brahmana Nasya is going to be there with.
So there is one more question, like this Vishatindukavati, what you have used, like in a dosage of 2 TID, how long it can be given to the patient?
It
Whether
can
it
be given
produces
at any time, madam. It can be, Vishatindukavati can be given for any time. And especially there is one more folklore practice also, madam. This is anti-diabetic very specifically. If at all we are giving any diabetic person also, say for example, we are giving the Karela capsule or something like that, or the Jamvasva, Jamvarishta. Along with that, if the Vishatinduka is being given, the diabetes is going to get controlled very fast enough. The Vishatinduka is very specifically used in 2 areas. One is where there is a diabetic to enhance the
effectiveness of other
nerve
medicines.
conductivity. Nerve conductivity. It enhances the nerve conductivity and regulates the control over the lumbar or any of the neural material, neural areas. Either it could be lumbar area or it could be of the peripheral nerves, or when there is a suptata, peripheral neuritis. At the time also, if we are going to use this Vishatinduka, it initiates and it separates and it makes the conductivity regularization.
There is one more question, like you are into the Ayur Jyotisham, and can you have some light on the Jyotisha part over the Pakshagata, or like whatever the cases you have?
Actually,
Of interest.
I did not expect this question. That's why I did not took any sort of the examples. But one thing, madam, here in astrology, Shani and Rahu are being set for the musculoskeletal conditions. This Shani and Rahu are for the musculoskeletal conditions. For the neural conditions, the Kuja and Ketu. We see some of the combinations of these things, and I have made exclusively another book also of the Ayur Jyotisham, in which I have classified a genetical disorders and the disorders which are going to be by birth. It is being associated with time boundness and the dietetics, and at the end dasha, based on the dashas, how the other diseases are going to be manifesting. It is coming very true, madam. Combination here we see astrological combination in Pakshagata is Shani and Kuja, or the Rahu and Kuja. If the Rahu Kuja is going to be there linked with the 5th place, then the Bala Pakshagata. And otherwise, it is reflective in the particular dashas. It is being witnessed. It is a different science, madam. Let us not combine here on this dais.
Thank you. And there is one more last question. Like, what is the intention of using Murivenna Taila in the Abhyanga of Pakshagata patient?
Huh. Actually, madam, in Pakshagata, I was speaking about the two aspects. One is the Anubandhata, second is the Margavarodhata.
Because it is used mainly in the Bhagna and all. That is why the
Exactly.
students have
Here,
asked.
exactly, madam. You are very perfect. This Bhagna, here the nerve tissue is broken, thereby the conductivity is not there. Wherever, whenever there is a conduction problem is going to be there, which could be evaluated on the MEP and MSEPs. When we do the MEP, the retarded MEPs are being absorbed in the patients, and thereby these patients were being used with that of the Murivenna. There is the break of nerve fiber is also a Bhagna, not only the mere the Asti Bhagna.
Thank you, sir. So your understanding and planning and the selection of drugs in the specific conditions of Pakshagata and the back pain or the Katishula is wonderful, because your in-depth knowledge, like the modern perspective of Ayurvedic physiology of Vata, like you have taken up, and according to that you have selected the medications in these particular cases. So we are acknowledged for your contributory informations in the treatment of these Pakshagata and Katishula. Thank you very much on behalf of our head of the institution and even the Department of Panchakarma, JSS Ayurveda Medical College, Mysore, Karnataka. Sir, thank you, sir. We are
Thank you,
privileged to have you here. Thank you, sir.
Thank you. Thank you very much.